Hello, I'm Diana Bijak. I am one of the social workers with Continuum Care Hospice. Today I will be speaking to you about Advance Health Care Directives, also commonly referred to as living wills or as medical durable power of attorney paperwork. I would like to spend some time discussing what advance directives are, who should have one, and the process for completing one. More importantly, I would like to talk about why advance directives are so important, especially now in the time of COVID-19. Advance directives are legal documents that allow patients to express who they would want to make medical decisions for them and the type of medical care that they would want should they find themselves in the midst of a serious illness or injury that is life-threatening. In the course of my career as a medical social worker, I've spoken to countless patients and their families about advance directives. I've found that it isn't uncommon for some individuals to become worried when I bring up advance directives because they think that I might be hinting that they are sicker than they know. However, I can assure them and you that advance directives are appropriate to create at any stage of an illness and really should be completed by all adults, all people over the age of 18, even those in seemingly perfect health. The benefits of having an advanced healthcare directive, regardless of age or health condition, is profound. First, advanced directives allow those who complete them to have a say in their medical care in critical situations where they are no longer able to speak on their own behalf. While it can be upsetting to think about such scenarios, I think it's important that we're all honest with ourselves and our loved ones, that all of us will pass away someday, and that many of us may, at some point in our lives, become so sick or injured that we are no longer able to communicate and advocate on our own behalf. Examples of such a situation might be a severe stroke, a terrible car accident, or advanced dementia. COVID-19 is another example of an illness that might render a person unable to communicate. We are seeing that a small but significant number of people who contract COVID-19 go into respiratory distress and require intubation and mechanical ventilation in a hospital. When you are on a ventilator, you are kept sedated and are relying on those around you to make appropriate medical decisions on your behalf. An advance directive could come into play in any of these scenarios. First, an advance directive selects a person to be your decision maker. For most people, this is a family member, often a parent, a spouse, a child, or a sibling. However, many others choose a friend to be their surrogate decision maker. The important part in selecting your surrogate is to choose someone who you trust, can communicate openly with, and believe will honor your wishes. If you aren't able to speak for yourself, your medical team can look at your advance directive and turn to your surrogate for any critical decision making. Second, an advance directive allows you to dictate the type of decisions you would want your surrogate and your treatment team to make based on your ideas about quality of life and the types of medical interventions that you find tolerable versus burdensome. This is highly subjective and unique to every person. I have met many ICU patients who have been on a ventilator in the ICU during a medical crisis who told me afterward, when creating their advance directive, that they would never want to be intubated again. They might then direct their surrogate decision maker via their advance directive to advocate for less invasive medical care, knowing that it might hasten their death in a future crisis. I've also met plenty of other patients who feel the risk of a bad outcome or the risk of physical discomfort due to invasive or aggressive life-sustaining treatments is absolutely worth enduring if it means preserving life. There is no right or wrong when it comes to deciding on the type of medical care that you want. We all have a unique perspective informed by our families, our lived experiences, our spiritual beliefs or lack thereof, and our larger culture. Decisions you make might be radically different than the decisions another person might make in the same situation. Your doctor or even your loved ones might not know the ins and outs of your values or exactly what decision you would make. So an advance directive takes the guesswork out of that process for them. And another important feature of advance directives is that they help relieve your loved ones of the burden of making very, very hard choices on your behalf. By providing a framework for the type of care you want, you are allowing your loved ones to feel that they are speaking on your behalf and honoring your wishes rather than worrying that they are making a mistake. Even in very dire situations in which a patient does not survive, research has found that there was a lower incidence of grief-related depression for the surviving loved ones when the patient had made their wishes clear and had communicated those wishes openly. Perhaps more than anything, the most valuable part of advanced directives is that they offer a jumping off point for very difficult but essential conversations among families and loved ones. While scary, this is a gift that we can all give our loved ones that demonstrates our caring and compassion for them going into the future. So now I'd like to get a bit more into the specifics of the form, including where to find it, how to fill it out, and what to do with it once it is complete. To begin, I would like to clarify some common misconceptions about advance directives. I found that people frequently confuse advance directives with a POLST, or a physician order for life-sustaining treatment. You may have seen this form before. In California, it's a bright pink two-page form. POLSTs are really meant for people with very advanced illness, such as people with an illness that might require a hospitalization in the very near future. POLSTs are concerned with more of the nitty-gritty of treatment decisions, such as decisions regarding CPR, intubation, and feeding tubes. Advanced directives are more general and, as I mentioned before, can and should be completed by all adults, regardless of current health status. Another difference is that the POLST can be completed and signed by the patient or by a family member or a court-appointed guardian if the patient is no longer able to speak for themselves. However, advance directives can only be created and signed by the patient. If the patient no longer has capacity to make medical decisions for themselves, say, for example, the patient has advanced dementia and is no longer able to understand the information given to them by their medical team, then they are not able to create an advance directive at this point, and their loved one cannot create one on their behalf. Another thing to remember about advance directives is that they can be revised. In fact, we recommend that everyone revisit their advance directives just from time to time to ensure that it's still reflecting their values. The type of medical care you may want at age 45 may be quite different from the type of medical care that you want at age 75. If you have multiple advance directives, whichever is the most recent is the one that will be honored. So, how does one go about finding and creating their own advance directive? There are a number of ways. If you're computer savvy, I think the easiest route is to simply get on the computer, get on the internet, and do a quick Google search. You'll find that there are a number of different versions of the form available online. Some are longer, some are shorter, some are very detailed, some are pretty bare bones. Some are specific to the state that you're living in, while others are more generic. It doesn't really matter which one you pick because they are all equally valid in a legal sense, so just pick the one that is easiest for you to read and understand. You might not want to pick one that says Washington State in the header if you live in California, but advance directives are transferable across states if you were to move. Another easy way to get an advance directive is to ask your primary care doctor for one. Advance directives are broken down into 5 sections. The first section is where you designate your surrogate decision maker or your medical agent. You are able to designate a second or third agent in case your first pick is not available when needed. Again, I should point out that your surrogate is not suddenly able to make all your decisions for you once you sign the form. Their ability to speak on your behalf only begins when you are no longer able to communicate for yourself, or should you specify that you want them to have authority starting immediately. Additionally, your medical agent will only have the power to make decisions regarding your health care. They are not also granted the ability to control your finances. As I mentioned before, you will want to pick someone who you trust and who has respect for you and your values. When selecting your healthcare agent, you will want to have a thorough discussion with that person or those people to make sure that they are comfortable serving as your surrogate decision maker, and you will want to convey to them what you would want them to know about your wishes and values if you were to become critically injured or ill. Some people choose to select a healthcare agent and leave the rest of the form blank. As long as the form is properly witnessed or notarized, then this is perfectly acceptable. Most people do go on to complete the second section of the form, however, where you express the types of medical treatment you would want should you be facing a life-threatening illness or injury. In this part, you can direct the medical team on whether or not to provide you with all possible treatments in an attempt to preserve or prolong life, even if it means that you most likely would not return to your previous levels of freedom and independence, physical function, or cognitive ability. Most forms will also have a write-in section in this part in which you can specify additional wishes for your medical care. The third section of the form is regarding your wishes for organ and tissue donation. This part of the form is completely optional. You can skip over it. The fourth section allows you to designate a primary care doctor. This section, like the one that came before it, is also optional. The fifth part of the form is where you sign it yourself and have it signed by either two witnesses or have it notarized by a notary. I personally and generally recommend using a notary to have the form completed simply because I think it's easier. The rules for who can be your witness are stringent in order to prevent anyone from witnessing the form who might also benefit from your death. The rules for who can be a witness are as follows. It cannot be any of the people you have designated as your surrogate medical agent in Section 1 of the form. It also cannot be a member of your healthcare team, so your doctor, your nurse, your medical social worker, your medical chaplain, your home health aide, and so on are not allowed as witnesses. It also cannot be an operator of a community care facility, an employee of an operator of a community care facility, the operator of a residential care facility for the elderly, nor an employee of an operator of a residential care facility for the elderly. Only one of the two witnesses can be a family member, regardless of whether that family member is determined by blood, marriage, or adoption. And any non-family members serving as witnesses cannot be entitled to any part of the patient's estate upon their death as stated in a currently existing will. So as you can see, it can be a little challenging to find two witnesses that are not excluded by the legal criteria. Notaries generally do have a small fee, but I find that using a notary is just more straightforward. Many notaries are also mobile and can come to you wherever you are, be that at your home or even at the hospital. One aside is that patients living in a skilled nursing facility will also need a signature from a patient advocate or the ombudsman for that facility. Once you've completed your advance directive, you will want to keep the original in a safe place that you will remember. You will also want to provide a copy to the person or the people that you have designated as your medical agent. You may also want to give copies to family or loved ones who are very involved in your care. You should provide a copy to your primary care physician, who can then store it in your electronic health record. And if you were to need to go to the hospital, it's not a bad idea to bring a copy with you to the hospital as well. Advance directives may sound intimidating if you haven't seen or created one before, but they are designed to be simple and straightforward documents that foster discussions about the type of care that you want for yourself. Again, the value of these documents is that they prompt serious thought about hard choices, and they empower you and your loved ones to make informed and thoughtful decisions about your medical care. I hope this brief video was informative. If you have more questions about advance directives, please don't hesitate to reach out to us at Continuum Care Hospice by calling our main office number. You may also call your doctor, nurse, or social worker for more information.